I love what I do. At 6 years old, decided I was going to be a dentist, and it stuck for whatever reason. And I do. I love what I do every day. It's a little bit of the artistic part, it's a little bit of mechanics, it's a little bit of engineering. I could not be happier with the career choice that I made at 6 years old. I had started working with a financial advisor who is a patient of the Shawano practice. And he had come in for his regular visit and called me after and said, my doctor's getting ready to retire, do you want to buy the practice? And I was like, it wasn't even on my radar. I said no. And then he said, no, I really think you should talk to him. I think it's a good opportunity. And so I came up and met with the doctor. He had built his building with another doctor. I didn't want to run into a situation where I was working in the same building with somebody I didn't know, and shared space and shared utilities, and there just was a lot of logistics in it. So I bought both practices and the building, and we were completely at capacity the moment I walked in. So I started working with Patterson on potentially finding a property to build the building that we're currently in now.
I was going to retire before I met Ashley, and when I met Ashley and we just hit it off so well, I went home and told my wife, I have to delay my retirement. I have to see this through. Could we improve those situations in the current environment, or did we need to recreate a new environment, repot the plant, so to speak? And in Ashley's case, Dr. Walsh, that's exactly what happened. It became very apparent in her current space that growth was not going to be, further growth wasn't going to be possible in her environment. A project like this doesn't happen overnight. This took about 2 years in planning and development, so we needed to try to get her out of her immediate pain points, and CAD/CAM was the way to do it.
Dr. Walsh had landed herself into a position where the 2 prior practices that she had purchased and consolidated were both older dentists, and sometimes that generation of dentistry is a lot more fillings, a lot more amalgam fillings, some things that are not all full coverage. We knew that her patient base was going to need a lot of crown treatment, and we knew that she didn't have the operatory space to fulfill all of those appointments and to get her patients back at a decent time to receive their permanent crown. So it made a lot of sense for her to have a machine right here that did it for the patients, and they could leave that day with her crown. That meant a lot to her.
She knew she wanted technology. That was a huge part of her growth, not only with CEREC, but also Cone Beam. She knew both of those things needed to happen pretty quickly. CEREC happened before the build, which helped obviously boost production and make this really possible.
Having the space to grow made a huge difference. So we were able to bring in more technology right away. We added more team members. We were able to bring on another doctor, which lightened the load from my schedule. So where we were originally scheduling patients out 8 or 9 months, we were able to pull that up and shorten that time frame for them for their treatment.
There wasn't anybody here using a scanner. There wasn't anybody here offering same-day crowns, and you didn't have to wear a temporary. And she did that, and now I think most of the offices here have adapted to that, and I think the patient standard in the town of Shawano has really been set a little higher because of what she did.
Having that same-day crown option available was just serving our patients better. So word kind of got around that we had that to offer, and patients started referring more patients, and we continued to grow, and now I have 5 full-time hygienists and a second doctor with a third about to start, and we're hoping that we continue to grow. What we do here in the office is serving our patients, serving this community, and really offering a level of service that we don't see very often.
The biggest thing I always ask people is, tell me your dreams. What would you like? It doesn't have to be what ultimately happens, but what would you like your practice to be like? And by asking those questions and listening to the answers, it's easy then to guide
I try to listen as much as possible. I try to hear pain points and what we can do to help. And I know as a territory rep, a large part of our job is just providing supplies, but it's so much more than that. Like, it's so much more with what are you seeing outside of this practice. You know, when you're in your own practice, you are only seeing what's happening day to day and not kind of the bigger picture of everything. It's really about the relationship to me and how the business and the business relationship grows from the personal relationship. So that's where I see value and where I try to run my day is do what's right for the person, and what's right for the practice will come.
All of my relationships that I have built with Patterson have become personal relationships. So there is for sure a professional working relationship. You know, there are times we just have to get things done. We need things. Everybody I encounter at Patterson has that mindset. Like, they are here to support the office, to support our team, to support our doctors, for us to know that we can continue to operate how we need to with what we need, and Patterson has our back on that.